Okay, so good morning to you all. For those of you who don't know, my name is Colin Allen. I am the Director of Events and Communications here at the New York, New Jersey Council. This is a New York, New Jersey Council event, in case you're wondering. Welcome to today's How to Do Business with session featuring Vizient. And so, without further ado, I will turn it over to our President and CEO, Terrence Clark, to make some opening remarks. After that, he will then turn it over to the Vizient team. So, Terrence, it's all yours.
Mm. Um, Good morning, everybody, and thank you, Colin. Um, as you all know, our council continues to look at ways to connect our business owners that are certified with us and our corporate members. It's a very important part of what we do, you know, and we think that it is a way for our business owners to get to understand and know a little bit more about our corporate members than just the name of a corporate member on our website. So, this morning we're honored to have our colleagues and corporate members from Vizient. We're going to talk about, several things, but one most important thing is how you do business with them, what it is that they do, what they buy, and what you need to look like as a vendor to be able to take advantage of this opportunity. Now, some of you may have attended our business opportunity exchange last week, last Thursday to be precise, and may have met some of our other corporate members in a meet and greet um, session we held in the afternoon. This is now going to give you about an hour or so of being able to meet with one corporate member so that you can begin to develop that skills, the knowledge that you need, as we are trying to get more and more people involved within this enhancing and expanding supply chain uh, of our corporate members. So I want everybody to really just take the time to listen. If you have questions, most certainly ask them or put them in the chat. And for all of those that are upstate and listening to this, on the 25th of July, we'll be having an event in Rochester in which this particular corporation will probably be involved in, which will then give you a face-to-face opportunity to talk to not only this corporate member, but other corporate members within our supply chain so that you all know, we have 160 corporate members. So there's, a tremendous amount of opportunity. It's on you now to try to take advantage of it and position yourself correctly. So hopefully this will be helpful to you. And as I've always said, if you have any questions, or is there any way that we can be of assistance to you as a council, please let us know. Ladies from Vizient, it's all yours.
Thanks so much, Terrence. We appreciate the warm welcome, and we appreciate everyone for being here and taking time out of your morning to join us today. My name is Star Franklin. I'm the manager of contracts and program services for Vizient's community contracting program. And we're working in conjunction with University of Rochester and Westchester Medical Center in upstate New York to really partner with them to increase diverse supplier utilization and penetration in the area. And what that means for you is that there's a lot of opportunities to gain business with the area of upstate New York. I'll pass it on to my next team member, Crystal King, to introduce herself.
Hello, my name's Crystal King. I'm the Senior Director of Operations for Community Contracting, and Star just told you what the program is all about. Our mission is to get back to the basics of engaging with suppliers. And we know that for healthcare systems in particular, that if we engaged our local and diverse talent in the supply chain, then those people get jobs in the community, and you get well, and you get insurance, and you buy homes, and you pay taxes. So we are really starting to look at supplier diversity from a lens of economic inclusion and economic development for our communities and rebuilding our communities. And Westchester, University of Rochester and Westchester Community are the first two members of that cohort in upstate New York. But we are doing this all across the countries in our communities that really need rebuilding, and where we see great health disparities and socioeconomic disparities. And we think that if we can help close that socioeconomic gap, that the health gap will close as a result of it. So we're so grateful that you're here, and we look forward to meeting you all. Adrian?
Good morning. My name is Adrienne Williams, and I am the Senior Program Services Manager for Upstate New York. So I am the individual that will probably see a lot of you all in person at a lot of the different events. I will be reaching out to you all as I continue to advocate for minority suppliers here in our area. So as we go on today, I'll be sure to provide my contact information. Should any of you have questions after this, I encourage you to connect with me. I will again be in upstate as often as I can. I'm located in Brooklyn, New York. Go New York. So I'm here and I'm personable, and I want to reach out and touch all of you all and get you all the much contracts that you need, that you deserve, matter of fact. So welcome, and we're glad to see you all here.
I see a future entrepreneur on the camera too, so I'm excited about that.
I think
Melissa.
Jennifer might be here, and Melissa.
Okay, Melissa and Jennifer, if you want to introduce yourselves as well, either one of you.
Hi, my name is Melissa. My name is Melissa Evans, and I report to STAR, and I work on working the contracts, negotiating, and execution for upstate New York.
Thanks, Melissa.
And I am Jen Zimmerman. I am the Senior Program Services Manager, and I work with all of our members in the community through the Community Contracting Organization.
Thanks so much, everyone. And I want to just start by again thanking you. And I will share some information about who we are, what we do, and why you're here, and what it means for you to be here. We really appreciate you taking the time again to just take time out of your day to learn more about Vizient. Can everyone see my slides?
Yep.
Great, thank you so much. So we want to talk today about Vizient and our community diversity strategy. Crystal touched on it a lot about how we're looking to be in the community and make sure that there is an economic development plan, and that starts with our diverse suppliers. So you're probably wondering who we are, what we do, and why we're here. And I really want to give an overview of that so you can really understand who we are and what we do. And if you have any questions, please feel free to drop them in the chat, and one of our team members will respond to the question, or I can answer the question here for you. So please feel free to stop me as well, and let me know that you have a question or drop it in the chat. So a group purchasing organization is what Vizient is, and we are a entity that provides contracting services on behalf of our members. And what we do is we really work to help them leverage all of their spending power together as entities and come together and get the lowest pricing possible on products or services. So we really want to help them not only improve their scale as healthcare providers, hospitals, nursing homes, clinics, home health agencies. We want to help them leverage their buying power and also standardize their buying. Make sure that they're buying from particular sectors such as diverse suppliers, and make sure that they really look at how they're spending their money. So we work with them to kind of inform them and partner with them on supply chain decisions as well. We also, in addition to contracting with diverse suppliers as yourself, we also work with distributors for products and services on behalf of members. So we have some of the largest distributors that we work with, like Owens & Minor, Medline, AmerisourceBergen, Cardinal Health. We work with those distributors as well on behalf of our members. And this opportunity, as we work with them, helps them to kind of leverage their buying power and save more money with contracts than they could on their own. GPOs have been around for over a century, and they've helped to not only help lower costs, but also identify best practices within the industry, increase competition by increasing the utilization of diverse suppliers and small businesses, and also make sure that we support transparency. We really are really transparent throughout the whole contracting process. When we start contracting with you, we go over the contract and let you know the terms and conditions so that you understand them fully. You can ask any questions of us at any time. And we also are overseen by an independent group called the Healthcare Group Purchasing Industry Initiative, and they oversee GPOs in total. We also partner with our members to talk with them about initiatives that they have in the community and the work that they're doing as healthcare entities to improve healthcare. We want to improve supply chain as we go through this process and really help them look at their data and see where they can do better to increase community engagement and also community health. Vizient also works with the nation's top providers. We have over 97% of the academic medical centers in the US as members. We have over 50% of acute care hospitals in the US as members and over 20% of the ambulatory care market as members. And we are the largest member-driven healthcare performance company in the country. We do have a full complement of sourcing, which are people that do contracts, analytics, people who look at data, advisory, people who consult and tell our healthcare providers how they can better improve their offerings. And we also have collaboration services. And what that really means for you is that we have the scale and depth to create greater access to contracts for you and opportunities for you to better scale your business. We also have mentoring programs with ICCC, which is a company who works with diverse suppliers to learn how to come to business with corporations like Vizient and other entities they would like to engage with. In addition to the membership base that we have, we also have a lot of data and analytics that we get from our suppliers, such as yourselves. And we also have our healthcare providers that provide us patient records and patient encounters. We also have expertise of healthcare providers. Some of our healthcare providers are the top providers in the nation, and they're really changing healthcare. So as you become a member and partner with Vizient, we really work to help you engage with that expertise and drive your business forward. In addition to that, we also have sourcing experts that have category specific focus in different industries. And we rely on our suppliers to also give us industry specific information and changes that are going on in healthcare. We also collaborate with our members to really give us information about how their communities are changing and how we can help. And also have councils that guide those decisions. And one of those is the Supplier Diversity Advisory Council. And they let us know how we can better engage with diverse suppliers as yourself and make the bid process and contracting process easier for you. The website for Vizient, can someone put that in the chat, please, from our team? Thanks so much. Vizient also has a sales team that works and is incentivized on making sure that contracts are utilized. We have over 350 acute care sales force. We also have over 70 of a non-acute care sales force and over 365 consulting associates that work together and are compensated on making sure that the contracts are utilized. So in addition to you going out into the field and working to make sure that you have contract utilization, if you were to become a partner with Vizient, you also have a sales force behind you that is making sure that the supplies or products or services that you sell are seen by our provider base, and that you have that traction that you might need. So you have a team behind you once you are a partner with Vizient. So now I'm going to talk a little bit more about Vizient's supplier diversity program and how it has evolved over time. The mission of our Vizient supplier diversity program is really to make sure that our members champion inclusion into their supply chains, and also that we're spurring economic growth for communities, as Crystal mentioned. We really want to make sure that we're including diverse suppliers into our utilization and our portfolio. And currently we have over 200 diverse suppliers within our national portfolio. As we've worked within this particular program, we have really made sure to partner with our diverse suppliers, and also to partner with other entities such as ICCC, which I mentioned earlier, which helps mentor diverse suppliers to help you scale your business. And we were established in 1999. And when we started our program, the focus had been very national in scope. We wanted to make sure that our diverse suppliers had the capability to serve nationally. But we can see that as we have gone through changes in diversity, equity, inclusion, and belonging, and we have gone through changes in supplier diversity as a whole, and changes as a nation, we have seen that our diverse suppliers mean a lot to the community, and they mean a lot to how supply chains are focusing on how they drive business strategies now. So supplier diversity has really become an economic strategy, because providing care to the local economy has a ripple effect. And that ripple effect is that it affects the social and economic factors within a community. Once you have a job, you can buy a car, you have better health care, you have better quality of care, you can eat better, and you can provide more for your family, you can buy a house. These are things that are being looked at by healthcare professionals now, instead of just looking at where can I purchase my supplies. They're looking at the upstream effects of how engaging the local community is really impacting the economic influence within the community. So that's why the community contracting program was enacted. And we really started our focus in really trying to work with diverse suppliers within local communities to drive penetration of diverse suppliers within an area. And as I stated before, we're now working in upstate New York in partnership with Westchester Medical and with University of Rochester Medical Center. And we are working with them currently to provide local contracts and visibility to local diverse suppliers in the area, because we want that local economic impact. So when we started this program, we kind of piloted it in 4 areas around the nation. We started in the East Coast, West Coast, Central area, and Southern areas of the US. And you can see our pilot areas here on the map. What we did is we looked at the most economically distressed cities and locations where Vizient's members were located, and we determined the top 50 cities and narrowed that down to about 10 areas where we were going to focus on community contracting and make sure that we contracted with local diverse suppliers. And in the Chicago area, we were able to see a 400% increase in diverse supplier utilization. So that speaks as a testament to the commitment that our members have to make sure that they're serving the community well by partnering with diverse suppliers and making sure that they utilize diverse suppliers. You may also be asking how we help market diverse suppliers to our members. And we have a few different ways in which we do that. We do have a Vizient catalog, and it's an online catalog that only our members have access to, where they can search for specific contracts. There is a supplier, a diverse supplier marker on the contract. If you have any sustainability measures for your company or environmental practices that you honor, that's also noted. If you have any innovative products or solutions that are not seen in the market, we also have an innovative technology program, and that's noted on the contract. In addition to that, we also launch a contract brief, which details the contract, gives a specific contract number. Thank you so much. Which details a specific contract number listed on the contract brief. We also list the pricing, any of the access information, how you can be contacted, and any additional information about the contracts on this contract brief. So it's basically a summarized version of the contract for our members that lets them know how to contact you, what products you're selling, and how we can do business with you, that entity can do business with you. We also have our Supplier Connections portal, which is done through a company called Supplier Gateway. And that allows for you to include information on your company and upload your diverse supplier certifications even before you get a contract with Vizient. We ask all diverse suppliers to enter their information there because that gives you immediate access to visibility by Vizient members. And it also lets you allows you to enter information about your any certifications that you may have from the NMSDC or WeBank or any women-owned, minority-owned, woman-owned, LGBT, disabled-owned, veteran-owned business certifications that you might have as a diverse supplier. It allows you to upload them to that website. And you can also include information about your product or service offering on the website, and that gives you access prior to becoming a Vizient member. In addition to that, like I said before, we do have our sales force that is incentivized on making sure that diverse supplier contracts are highlighted with our providers. So you may also be asking what type of categories we're looking for. And the list on the screen is not all inclusive, but these are the list of categories that we found were really helpful to our members through the pilot program. And as we've continued the official program, which was launched in 2022, we have seen that these particular categories are still of interest, and a lot of these are service-based. And the reason why there are a lot of service-based categories are because those are the areas where diverse suppliers are concentrated in for the most part across the country. Any of your services that may be outside of this product or service scope may also be considered. So I would still encourage you to apply for information regarding whether or not you're eligible for this program. And the next steps for this program would be to complete an eligibility form. You can go to the website listed below, and I'll also put it in the chat. And you would fill out an online eligibility form and also sign a non-disclosure agreement to be vetted. In order to be eligible for this program, we ask that you have certification with a third-party certifying body as a diverse supplier. If you do not have certification at this time, that is also okay. We ask for you to provide proof that you are in the certification process. And if you need more information on the certification process, you can also interact with the New York and New Jersey MSDC, and they will help you with that. Or you can contact us to walk you through the process as well, and we can help you with that, because we also do help with those entities that may not yet have certification or are looking for information on certification. And getting certified with a third-party entity as a diverse supplier is really key in helping you get a lot of these opportunities with corporations. After you go to this website that I have listed here, you would click on the eligibility form in orange area. And it will lead you to our website where you can enter your information for your eligibility and include all of the information that's needed. And the information that we're looking for on the form is the number of suppliers, or I'm sorry, the number of employees that you currently have. We're also needing information about your current financial status. And we ask some questions about that, whether or not you offer healthcare benefits, and what your shifts are. We're trying to get a picture of who you are as a business so we know where you're starting, because we also want to track your progress over time to ensure that you are growing. The point of this program is to ensure that you have growth and that you make sure that we are partnering with you well to ensure that you can grow your business. All right. Do you have any questions? I can, that website that I mentioned earlier here has a playback of this whole presentation. So you can view the video at any time, and it's an on-demand video that will help you go through the process of really understanding the community contracting in full. No problem, Carol. Does anyone have any questions?
I know someone's thinking something. That was a lot of information.
That really was. I know you all have questions.
Yeah, I have a question. Can we get a
Sure.
copy of this presentation?
I cannot send out a copy of the presentation. However, at that website that is now in the chat that somebody else put in there for me. Thank you, Ajita. The website is actually listed there. And on that website is an on-demand video where you can view this presentation.
Yeah, I see that. Yeah, thank you.
Mm-hmm. Were there any other questions that anyone else has? That means I did a really great job of explaining this to you.
Yeah, definitely.
Do any of the suppliers on the call currently work in upstate New York? If you could.
Yes, I do. Good morning. This is Shondetta Miller from William W. Professional Staffing. We do have a few contracts in healthcare. We provide nursing staffing services in upstate New York.
Okay. All right.
Good morning. And I do have a question.
Sure.
I would like to know what are the length of the healthcare contracts in upstate New York?
That's a great question. The term of the contract is 3 years. That's the initial term. And there are 2 one-year auto renewal periods that are built into the contract as well. So as a total, it's 5 years.
Thank you.
Mm-hmm.
Shandita, is that how you said you pronounce your name?
Shondetta.
Shondetta. Okay,
Yes.
I'd be interested in you sending us some information about your company. I'm sure, as you know, hospitals are still bleeding, literally from the pockets because of the upsurge in pricing for staffing during the pandemic. And so now people are really looking for solutions to help level that out some. So I'd be interested to know if you have any suggestions on how healthcare systems can get back to, I know we'll never go back to pre-COVID rates, especially for nurses and doctors. But if you have any suggested ideas on how your company's going to move forward, I'd be interested in hearing about that.
Yes, certainly. Please provide your contact information.
Sure.
So we got a few questions coming through in the chat.
Sure. Thank you so much. Let's see this here.
Non-emergency medical transportation, STARS.
I
That's a
saw,
big deal.
and I saw another question too. Before that, suppliers can be in other areas other than the areas we saw on the map. And thank you for that, Lamar. That information was the pilot program that we had for community contracting. The current areas that we have launched for the official program is in upstate New York. We also have Michigan, Minnesota, and the Gulf South states, which include Louisiana, Alabama, and Mississippi. So those are the areas we currently have open now. And go ahead, I'm sorry.
So one question that comes to my mind, and that is, how do we have bid on a nationwide contract with Vizient for staffing, and I don't know what happened to it because we sent the reminders a few times, and it has been a year and a half or so. But irrespective of that, what do we need to do to be a part of it?
Okay.
Going forward.
If you already have a contract with Vizient, I would like you to send me an email at communitycontracting@vizientinc.com, please, so that we can look into.
Email address, you said?
It's on the screen right now. It is communitycontracting@vizientinc.com.
I'll send you one. Yeah.
Yeah, send us an email there so we can kind of research your particular situation and see what we can do.
Oh, I just wanted to say that I'm an MBE in the Hudson Valley. I don't know what you consider upstate New York, but I've done, business in Albany and also with the New York Power Authority. So, happy to connect with you for more.
Thank you so much. We'd like to connect with you as well. So please go to the website that's listed here in the chat and fill out your eligibility form. And if you have any further questions, please email us at the community contracting email address that's listed here in the chat and on the screen, and we'll be able to help. And
thank you.
I'm going to go back to the chat. Thanks so much. James had mentioned that you're a non-emergency medical transportation company, and we are definitely looking for that. That is definitely one of the categories we're looking for. So we'd also like you to connect with us so that we can talk about your services and what you offer and where you offer your services. After you fill out your eligibility form via the website, we will connect with you so that we can explain next steps to you in the process, go over the contract, discuss the terms and conditions with you, and any questions that you might have about the terms and conditions, and start the process of being vetted and contracting with Vizient. All right.
Star Suresh Sangha from Higher IT. I have a couple of questions.
Hi.
Okay, the first question is, I know I have met the University of Rochester, E, and she did recommend you very strongly and to connect with you. And besides the University of Rochester, and who are some of your major current clients? Okay, in upstate New York or elsewhere, who are some of the client list? And secondly, my second question is, we are a very strong IT staffing firm, and we also have a fully owned subsidiary called Staffingly, wherein we provide a lot of pharmacists for the long-term care and specialty pharmacies. So in your in your categories list, I did see IT staffing and nurse staffing and all, but do you also take the pharmacist? Okay, so the two questions: who are some of your major clients, and do you also need time to time the pharmacist support?
Thanks for that. We do have a list here that includes staffing, and it does include IT staffing. We get requests for pharmacy staffing every now and again, but pharmacy is a completely different section of Vizient, and they do have a different kind of framework in which they provide services such as staffing. We also have existing partnerships with staffing companies. So we ask that any staffing companies that join us not be nationally based, but really be regionally focused, and also not offer any managed services capabilities as well. So there are some caveats there for staffing companies. We can talk a lot more about it if you email my email address, communitycontracting@vizientinc.com, to kind of go a little bit more into it and discuss what your company's capabilities are, so we can understand a lot more about how we might be able to service you or how we can partner together.
Oh, wonderful stuff. Wonderful. And thank you all for a great session. Thank you, Crystal. Thank you all.
No problem. No problem. Thanks so much for that question about innovative technology. Our innovative technology program is really a program where our suppliers are vetted through kind of a council based of our members that really looks at cutting edge technology and cutting edge products or services that are not currently available in the market, and awards contracts through that program based on that. It is a non-bid process where suppliers can enter that particular program for innovative technology. Once you are awarded an innovative technology program, you are designated as an innovative technology contract. And if you're a diverse supplier, you're also noted as a diverse supplier on contract as well. So those are the attributes for innovative technology. And they really go through a process, a panel kind of decision to come to that conclusion of whether or not to award contracts for innovative technology. The NICS code varies. It's not really specific to one industry or code. It can be anywhere. So I hope that answers the question. Did that answer your question?
So I need to ask a question on the same line. Innovative technologies. We have built and we are building healthcare software-based Epic with Epic association and derivative from there, certain healthcare products and databases for better use and better utilization of patient and doctor's information and correlate them. We are doing it today. How do we get involved in that or presenting it as a part of it?
So I think a couple things are important there. You can always, if you have a capability statement, you can always send it here to our community contracting at VizientInc.com, but we would have to then ask the provider if they are an Epic house. You would be surprised, not all healthcare centers are using Epic. And then we would have to figure out what type of, are you saying you have a credentialing system for physicians?
Yes, we already put a bid out with Vizient, through Vizient, for some open technology staffing and stuff like that was out there 2 years back. So we already bid on it.
And so know that the way this is set up is there's a national bid, there's a national portion for supplier diversity that really puts you in the pool to work with anybody across the country. This program that we're presenting today is specifically community contracting. So this is more for the local economies. There is a teammate, Lashia Strong, who handles the national contracts, but if you were to send us an email at the community contracting at vizientinc.com, we can surely forward your information on to Lashia.
No, we already bid on the contract on a national basis. That's what I'm saying to you. Okay.
So did you get a response? Were you successful or no?
It was okay. No, nothing has come through, and we have sent a couple reminders. There is no response.
Those national bids can take a long time. If you can imagine, there are vendors from all across the country presenting, and they're usually very high dollar, and going through those can take a bit of time. So don't be discouraged if you haven't heard back. This process moves a lot faster and is a little bit different than that national contracting, but the national contracting bids can take a long time.
I understand. We worked through Cindy Pompoa or something like that. I don't remember the exact name, you know.
I don't know that name.
She was a bidding contractor, bidding interface mainly. Okay.
All right. So
but thank you very much. I think it's a very valid program, and I think there is a lot of merit and benefits.
I think he froze.
Thank you.
Thank you so much. We appreciate that.
Yeah.
Thank you. And if you have any questions about your specific.
Yeah, I did send the email just now to you.
Okay.
On the community contracting. Okay.
Sounds good. We'll follow up with you. Thank you so much. Thank you so much. You read my mind. Anybody else have any questions? Yes, Bruce. Browning. Yes, Bruce.
Hi, thanks for the presentation. That was great.
Thank you.
A question about what Crystal was just mentioning. What we're talking about is mostly aimed towards building up the local communities in upstate New York, and I guess even down to Hudson Valley, Westchester. Does that mean that these contracts are only from providers in those areas, and we won't be competing with providers that are more national?
That's a great question. As Crystal explained earlier, we do have a national bid process where you can bid as a national provider of a product or service. And we also have this program, which is focused on community contracting, and specifically, as we're talking today, this is for the upstate New York area. So it would be concentrated in the areas of Rochester, Westchester counties, and those areas. And we are focused particularly on that for community contracting. But there are plenty of opportunities for diverse suppliers to also get on contract with Vizient through the national bid process as well.
Right.
And that can be found at the Vizient.inc website as well.
So our concentration is for local suppliers through this program.
Great. Okay. Thank you. I see my services fit one of the categories: commercial printing and direct mail, and branded apparel and branded merchandise. So I'll sign up and
thank you.
Thank you. We're glad to hear that.
You to contact.
Somebody
Can you repeat that again for me?
Oh, sorry. Here's some feedback. Are we after we sign up in that next step slide at that link? Should we then get in touch with someone from Vizient that's on this panel, or just be automated from there out?
What we'll do is we'll contact you once we receive your eligibility form and contact you regarding next steps. And we'll work with you through that process as you submit your eligibility information.
Okay, great. Thank you, Star.
No problem. No problem at all.
Looks like Leonard has his hand raised. Leonard, are you there? You had your hand raised.
Yeah, Leonard, you have to unmute. We had to mute you because you had a lot of feedback.
Can you hear me?
We can hear
Hello?
you. We
Good.
can hear you,
Good
Leonard.
morning, and thank you so far for what you have presented.
Good
My
morning. Thank
question
you.
has to do with the degree of detail that is needed and whether your software will save as one goes along, or whether one can go through the entire list to see what is needed, so that, and will it save as one goes along, or does one have to start over each time?
Thanks so much for that, Leonard. When you're entering the information for eligibility, is that what you're asking? The eligibility form, the online
As a
eligibility?
starter, yeah, I believe sometimes the requirements of an organization such as this one can be extreme.
This form is not really a long form. It does ask you to attach information such as any third-party diverse supplier certification you might have, a certificate of insurance, any of your balance sheets that you might have. It's not a particularly long form, but it does request that you include attachments as you go through the form. So what we would ask is that you dedicate some time set aside to complete the form. It will not save the information if you start at a point and start again later. Or you can keep the browser up and then complete the form later if you have to go do something, so that you can complete the form. It's not, I don't think it'll time out for you or anything like that. I'll check, but I can email you directly. If you email the community contracting email address,
I have done so.
Okay.
You look at the emails during
Sounds
this
good.
presentation.
Sounds good. I will email you back and give you information on whether or not it times out. But I see your question here, so thank you so much for sending that. And I will respond back to you with the answer to your question. But I would suggest initially just setting aside some time to complete the form.
Gotcha.
Thanks so much.
Thank you kindly.
No problem. Thank you, Leonard, for your question. That was a really great question. Everyone's had really great questions to ask today. Does anyone have any other questions they'd like to ask?
Well, we're excited to meet you all and start to engage with you all. This has been awesome. Thanks for your time, and thank you, Colin and Terry, for allowing us to be here today.
Yes. We really appreciate our partners at the New York, New Jersey MSDC office for just offering us this opportunity to talk to you, and for you for registering and signing up for this opportunity, and really investing in yourselves in the time that you're taking to learn more about how to work with corporations. We enjoyed the conversation with you today, and if you have any questions, please feel free to reach out at communitycontracting@vizientinc.com. And if you have any further help that you might need as you go through the eligibility process, please feel free to reach out at that same email, and we'll reply to you as soon as we can.
Yeah, thank you, Crystal. Thank you, Frank. Thank you, Star. Thank you,
I'll
everybody.
I'll pass it back to Colin.
Yep, I was just getting ready to pass it back to Terry. You have any closing remarks, Terry?
No, other than we're certainly pleased with the interactions that went on this morning. Once again, this is all about developing relationships and getting information that's key. And as I say all the time, one of the things we want all of our clients to be is not just hearing about things, but also seeing things. So this puts you in the ear and eyewitness position. Now the thing is to determine what's the best way to take advantage of what you've heard this morning, and hopefully all that fit within the categories that were noted in the presentation will be able to do so. So, ladies, thank you all for the information that you provided this morning. We're very appreciative of the time you've taken to address our clients. And we look forward to further collaboration as your program begins to expand and more of our clients begin to hear about it. So I hope everybody has a great rest of the day. And we'll all speak soon. Thank you all for your time.
Thank you, Terry.
Appreciate
Thank
it.
you all.
Thanks, everyone.
Thank
Thank you.
you.
Thanks very
Bye.
much.
Thanks so
Right.
much. Bye-bye.
Bye-bye.